Thank you very much, Dr. Ezike. And we're now 11 days into phase 2 of our Restore Illinois plan. And I want to provide two updates, one on where each of our 4 regions stand on meeting the reopening metrics, and the other on the projections of our modeling cohort. As a reminder, the modeling that we follow is led by top researchers from the University of Illinois, Urbana-Champaign, Northwestern University School of Medicine, the University of Chicago, the Chicago and Illinois Departments of Public Health, and is managed by Civis Analytics. The modeling uses IDPH's data of daily COVID-19 cases, deaths, hospitalizations, ventilator and ICU usage, all of which is provided by every hospital in Illinois and by labs that are running COVID-19 testing. Since our last modeling update, the researchers have been able to plug approximately 2.5 more weeks of data into their models, and that's significant. As I told you in our last conversation on this topic, the essence of models is that they get smarter over time. The more days of data that you have, like how many COVID-19 patients were admitted to the hospital or how many cases were tested positive, the better their ability to project future outcome. Everyone tracking our state's data has likely seen that on a statewide basis, we haven't passed our peak yet. We have seen more stability in our numbers, but so far we are not seeing significant declines in key metrics like hospitalizations. The updates to our models reflect that data. Compared to the forecasts that I shared with you on April 23rd, which predicted peaking between late April and early May, that time frame of plateauing near a peak has been expanded from mid-May into mid-June. In many ways, this news is disheartening. We have made great progress, but it's forced us to remain at a moderated, though still high level of key metrics for this extended period. A pushing out of our estimated peak is a natural consequence of flattening the curve. Remember that no one can truly stop this virus without a vaccine. But what we've been aiming to do since early March is slow down the exponential rate of transmission. When we do that, it leads to a slower rate of infections over a longer period of time, giving our healthcare system the ability to treat those who have complications and giving our pharmaceutical researchers time to develop effective treatments and potentially a vaccine. Pushing the peak down and therefore to a longer time frame might not sound like good news to some, but I promise you, it is saving lives. A couple of other notes on our statewide projections. You'll recall that the R0 value refers to how many other people on average will contract a disease from one person with that disease. An R0 value above 1 means that each infection causes more than one new infection, and that means more transmission. The higher the number, the faster the infection is spreading. An R0 value below 1 means that each existing infection causes less than one new infection. Over time, that will lead to a decline in new cases. An R0 value of 1 means transmission are stable. When COVID-19 started, an estimate of our R0 value was 3.6. That was before all the mitigations that we put in place, which nearly all of you have followed. Right now, I'm told our R0 value for Illinois has fallen to 1.0, but not below 1. Once we get down to an R0 value below 1, that will be very good news for all the people of Illinois. Our models also show that our hospital capacity and resources statewide are now sufficient to handle the current rates of transmission. That is, under our current phase 2 mitigations. There are those who advocate removing all restrictions now or at the end of this month, rather than taking the gradual course that our Restore Illinois plan does. If we were to lift all of our mitigations entirely at the end of the month, modeling shows that there would be a new surge of COVID-19 and a higher R0 in each of the 4 regions, even in the least hard-hit regions of our state. Let me say this another way. Lifting all of our mitigations at the end of May would likely lead to a second wave of outbreak in each and every one of our 4 regions. That's why the Restore Illinois plan gradually loosens mitigations in each phase while introducing the face covering requirement, which is one of the best public health measures to keep the transmission rate low. To reach the next phase of recovery, we introduced health-centric reopening metrics, and I want to review how each of our 4 regions are faring since May 1st. Thus far, all of our regions are on pace to hit all of the metrics for moving forward after the 28-day period, with possibly one exception. In the Northeast region, the positivity rate as of midnight on May 8th is at 22.3%, which is, of course, higher than the 20% cap on this metric to move into the next phase. This positivity rate cap will be measured over a 14-day period, so there's time for the Northeast region to fall below this cap. As for what positivity looks like in the other regions, the North Central region is sitting at 9.1%, the Central region at 6.0%, and the Southern region at 10.5%. Because hospitals vary in the time they take to submit and verify data and diagnoses, the data that I share here and the data you can see on our website reflects our hospital landscape as of midnight on Friday, May 8th. To date, all the regions have seen a dip in hospitalizations since May 1st. An 18.6% decrease in the Northeast region, a 35.8% decrease in the North Central region, and 44.4% decrease in the Central region, and a 54.3% decrease in the Southern region. Remember, the requirement here is that a region sees no overall increase in hospital admissions for COVID-like illness across a 28-day period. So far, every region is on track to meet this metric. And for the third requirement of available surge capacity of at least 14% for each of the medical surgical beds, ICU beds, and ventilators, in the Northeast, med-surg bed availability was 17.8%. ICU bed availability was 18.8%, and ventilator ability was 64.3%. So far, all hospital metrics are being met in the Northeast region. In the North Central region, med-surg bed availability was 41.1%. ICU bed availability was 40.6%, and ventilator availability was 64.9%. All hospital metrics are being met in the North Central region. In the Central region, 52.4% of med-surg bed are available, 44.2% ICU bed availability, and 74.6% ventilator availability. So all hospital metrics are being met in the Central region. And in the Southern region, 45.8% med-surg, 28% ICU bed availability, and 80.7% ventilator availability. All hospital metrics are being met in the Southern region. Over these next 18 days, I'll share updates on this information with you regularly, at least once a week, with likely more updates as we get later in the month.